Well, good morning. It's a Wednesday morning in the Isle of Man, and today I've been asked to do a video on Sculptra. Who's our patient this morning? Well, it's actually Karen, who's our aesthetic nurse in the Isle of Man, and she's been wanting Sculptra probably for the last year. She had some Sculptra around about 2 years ago with her mum, and I've got Joyce here, who's one of our fabulous, and believe it or not, 70-year-olds that come to our clinic, yeah? So, Joyce, good morning, Joyce, how are you?
Fine, thank you.
And you had Sculptra, was it about 2 to 3 years ago?
Yes, must be.
Okay, and you were happy with the result?
Yes, very.
And you've asked me to do Karen's Sculptra today, haven't you?
Yes, I have, yes.
Okay, so what we're going to do is we're going to look at Karen, who's stood in the corner, yeah? And if you look at Karen, Karen has what I always say, what I call cat's whiskers, yeah? So again, if we smile, she's very, very, very thin lady, very beautiful. And it's one of those things that I always say, you can be thin, but often we get lots of wrinkles with that. As we age, if you look at Karen, we've lost a lot of fat within the malar region here, around the mouth. And if you're one of those ladies that looks in the mirror and says, all I want to do is this, yeah, that's one of the cases with Sculptra. So in a case like this morning, we're going to put 2 vials, Karen, into the upper part of your face. And hopefully, I won't give you too many bruises. Sometimes you can get a bruise with Sculptra, that's just one of the things that happens, but Karen's a great client to do. What it actually does is it basically produces her own collagen. This will take around about 3 to 6 months to actually work. I'll show you the whole procedure this morning, but there are clinical trials to say that Sculptra now lasts up to 25 months, and that again is on a great blog called Beauty in the Blog. I'll blog about that myself later. So Karen, if you'd like to take a seat, we'll start the procedure.
Okay, thank you.
So ladies, here we have Sculptra. Sculptra is actually mixed to around about 9 mils. We normally mix around about 48 to 72 hours before. In case of Karen, we're basically going to inject into what I call the cat's whiskers. And I'm going to show you how that procedure is done this morning. So now I'm in the treatment room. Karen obviously is my patient this morning. And again, what tends to happen, Karen, can I just sit you up, please? Mm-hmm. As we age, yeah, people often think, do we actually grow new skin, yeah? No, we don't grow new skin. What happens in a typical face, we start to lose fat within the malar area here. The bone starts to resorb back, and hence that's why we start to develop the jowl. This area is typically what I would call the cat's whiskers, yeah? So again, Karen's a typical lady, and also a lot of men have this problem in the fact that we started to lose fat, muscle, and also bone within the facial area. What we've done on Karen before is we've injected, probably around about 8 to 12 weeks ago, some Sculptra within the temple area, and that's because I want a lifting effect. Today what I'm going to do is I'm going to concentrate underneath the mouth area. We're going to inject here and also along the what I call the zygoma area. So Karen, I'm going to pop you back. Ladies, I always tell you that it's quite a deep injection. The first thing that we do is we put what we call a topical anaesthetic, which is an emla cream. Also within the solution that we inject, we have some form of local anaesthetic, so again that makes the procedure comfortable. Sculptra, I always say there isn't anything on the market that can compete against it. It gives us great natural result, great volumisation. The thing that I like about Sculptra is that it makes our own body reproduce collagen, thickens the dermal layers, and most importantly, it gives me a nice result that again, as I said, can last up to 25 months. So back onto this, Karen. Mm-hmm. What we effectively do here is we come deep in within this area, and we have Wendy here this morning to watch this also. Morning, Wendy.
Good morning.
Wendy's also had Sculptra injected in the past, have you not?
I have.
And
Keeps
Wendy, were you happy with the actual result that you had?
Yeah, very happy. Nobody actually noticed, but everyone kept saying how much better I looked. I was finding I was getting a little bit jowly round here when I smiled on photographs and things. So it's just given me that youthfulness without having anything too dramatic done, and it lasts fantastically.
And how long ago, Wendy, would you say that you actually had that injected?
3 months.
Okay, the second lots of injections. What I tend to do within this area, this typically underneath the mouth is called the marionette lines. And effectively what happens is people tend to start telling you, all the clients, that they look sad. So effectively what I've done is I've injected about 3 mil within this area. What I'm also going to do is I'm going to come along just onto the cheekbone area, and I'm going to start injecting very slowly here. How are we doing, Karen?
Okay.
Okay. Karen will be able to feel this. I mean, Karen, it's important that you tell the clients how you feel as this is being injected. Again, very, very deep injection. It's not like a filler. A filler such as Restylane or Perlane or Juvederm will give the client an instant, what I call satisfaction, i.e. that it works instantly. The likes of Sculptra I inject, and if I show you half of Karen's face when I set her up, she'll instantly look better, but it's because I've injected with saline. This product will disappear within about 5 days, yeah? And I think that's very, very important that when you're speaking to a client that you understand that when I show you, it will look better, okay? But the product disappears. What then happens is it starts to stimulate collagen production. It's extremely important that the client massages the area, probably 2 to 3 minutes a day for at least 2 to 3 weeks.